Dr. Sandeep Jha. I'm a liver disease specialist and a liver transplant surgeon. And today we're going to talk about the treatment of liver cancer. So, there are many types of treatment of liver cancer that you must have heard of, and the patients are generally confused about what kind of treatment they should go for in cases of liver cancer. So, the most important thing about treatment of liver cancer is that the best treatment is when you can remove the whole of the tumor from the body, including every cell that is present. So, the two therapies that allow us to do that is liver resection, when we cut out the tumor along with a small portion of the liver outside the body, or liver transplant, when we are removing the tumor along with the whole of the liver outside the body. So the chances that we would have removed all the tumor cells are the highest when you're doing a liver resection or a liver transplant. So these are the most effective and curative treatment for liver cancer currently. However, it is not always possible to completely clear the tumor cells from the body. In fact, if the tumor has spread beyond the liver, then it is practically impossible to remove all the cells from the body. Whenever the tumor is inside the liver, then we do a liver resection, in which you must have heard of right hepatectomy or a left hepatectomy, where we remove the part of the liver from the right side or the left side, and that takes care of the tumor and removes the whole of it from the body. However, that is not possible if the liver has cirrhosis on the background. Like I said, most of the liver cancers occur in a background of cirrhosis. So it is very frequently it is not possible to remove the liver tumor if the patient also has liver cirrhosis on the background. So in those cases where there's a liver cancer and a liver cirrhosis, then the liver transplant is a more effective therapy for these cancers, because it takes care of the cancer and the liver cirrhosis at the same time. So it is very effective. Now, if we do a liver resection in a patient who has cirrhosis, the patient might land up into liver failure. So a liver transplant is more effective in such patients. So, like I said, the two most effective and curative therapy for liver cancer is liver resection and liver transplant. Sometimes liver resection and liver transplant is not possible. Why? Because sometimes the tumor is stuck to the main blood flowing vessels. Like if you try to remove the tumor, the main vessels will be harmed and the patient will bleed to death, or it is very close to these vital structures, or the patient is quite old and he might not be amenable to such a big surgery, because these surgeries take up to 4 to 5 hours and transplant takes up to 10 hours routinely. So the patient is very weak or old and cannot withstand such surgeries, then we utilize other therapies. And the next step in these therapies is burning the liver cancer, and that is achieved through RFA or MWA, that is radiofrequency ablation or microwave ablation. In this, there are thin probes that go inside the tumor, and they burn the tumor so that the majority of the tumor is burnt and the cells don't survive. However, the problem is that they can only work in a small tumor, and they do not effectively kill all the tumor cells, and hence the chances of recurrence are higher in RFA and MWA as compared to liver resection or liver transplant. However, in patients who cannot undergo liver resection and liver transplant, they are very commonly used therapies for such patients. Then, if the tumor is larger, then the role of TACE or TARE comes, that is Trans-Arterial Chemoembolization, TACE, in which chemotherapy drugs are injected inside the tumor and these chemotherapy drugs help to kill the tumor. The other therapy that is used in large tumors which are unresectable is TARE, that is Trans-Arterial Radioembolization, in which small radioisotopes are injected through an artery into the liver tumor, and these radioisotopes then then give out radiation which kills these tumor cells inside the liver. And this is also a very effective therapy to control the liver tumor. However, there is a potential of higher recurrence with both TACE and TARE because they do not kill all the cells at 100% rate. So the chances of recurrence are always higher. Then if the tumor has spread beyond the liver and has gone into systemic tissue and the other cells or is in the blood circulation, then we have to utilize chemotherapy or immunotherapy, and these are drugs that are injected and they help to kill the liver cells if they are advanced or so-called stage 4 cancers. So these are the therapies that are used for the treatment of liver cancer, namely liver resection, liver transplant, RFA, MWA, TACE, TARE, and chemotherapy. But the role of all these treatments are different in different patients, and we have to choose which treatment will benefit the patient the most. So if you think there was important information in this video and you benefited from it, then please like, share, and subscribe to my channel so that more and more people can benefit from it. Thank you.